With COVID-19 hospitalizations remaining low, plans are starting to pick back up, and that includes family planning. Pregnancy is a very special time for a woman and her family's life. But how have maternal and perinatal health changed in the past few years? Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
So we've heard that some women put off planned pregnancies during early lockdowns in the pandemic, and right now there are, changes being made. We're seeing that live as we're going through this year. Some women aren't waiting anymore. So we wanted to talk to a doctor and ask some questions about family planning, whether it's your first time or maybe you are continuing to grow your family. And so we're here now joined by our Dr. Jessica Affan, an OBGYN with Orlando Health Physicians Associates. Thank you so much for being with us today.
Thank you for having me.
So let's talk a little bit about this. I have a friend who just had a baby this week, and she had a very descriptive birth plan.
Yeah.
She wanted certain music playing, she wanted certain lighting.
Yeah.
And then things changed,
Absolutely.
right? So how do you talk to your patients about the way that they plan for that big moment?
Yeah, I think it's important to think about the things that you want to occur during your birth and pre-planning with your partner and thinking of what the ideal situation would be and bringing those wishes to your doctor and discussing those. But in reality, sometimes you get everything that you want and sometimes those things skew from the plan. And so it's important to be flexible and make sure that you're listening to the people that have the most experience so that you can make those adjustments as needed.
And everybody always has an opinion, right?
Yes.
Every mother-in-law, every, sister, everybody wants to tell you what the best plan will be for you. So how do you encourage your patients to kind of speak up for themselves?
I think it's important to speak up for yourself, and that's what a birth plan can kind of do. It is kind of setting forth what your wishes are, and a lot of times people will fill out a piece of paper or a form online, and they can bring it to their doctor, and it kind of lets their voice be heard. Also, bringing a copy to the hospital allows the nursing staff to look over it, so then when you might be a little bit intimidated and an experience that you're not used to, they know what you want.
How about when you're just talking to your patients about family planning in general? I mean, sometimes it's unexpected. You don't realize that it's going to take months to get pregnant.
Absolutely. It can be a unplanned experience.
Even if you want it to be perfectly, the type A's out there who want everything to happen exactly.
Unfortunately, our lives don't happen that way.
Right.
Yeah.
How do you counsel people through that? What are some ways that you can, encourage your patients to just go with the flow a little?
Absolutely. So it's important just to listen to their advice and to try to do things that keep your stress low and, exercise and self-care and know that things happen when they're meant to happen.
Do you ever have patient visits where you just sit and talk about pregnancy planning?
Absolutely. We do that all the time. We talk about ways that people can prepare to keep themselves as healthy as possible. And we also talk about things that they can be doing to prepare for giving birth and being pregnant.
Those last few appointments before the big moment, the big time in the hospital are very important.
Absolutely.
And I know that before pregnancy, one of the things you discuss pretty regularly are prenatals and when to start those prenatal vitamins.
Yeah.
Can you talk a little bit about that?
Yeah, so if you are thinking about getting pregnant or if you're not using anything to prevent pregnancy, it is important to be on some type of prenatal vitamin or folic acid supplement. Usually I recommend at least 3 to 6 months before somebody is thinking of that because that helps prevent neural tube defects in babies. So it's one of the things that you can do to keep your body healthy and to prevent a fetal defect.
And that's important to be doing months before you even get pregnant.
Yeah.
I don't think everybody knows about that.
Yeah.
What about some of those birth plan items that you would not suggest? Is there anything that you tell people, maybe don't put that on the birth plan?
Yeah, I think that you can say, I would like to have these people present. I'd like to have certain music or certain lighting or, I want to have a natural delivery. But again, there needs to be flexibility. So saying, I absolutely do not want an epidural. Well, there may be a chance you might need an epidural, or to say I absolutely want no IV fluids. Sometimes your body needs those things. So really the flexibility is the big thing. So having no, I do not want, or say just I prefer not to have this.
Yeah. And try to remember that the people that are there for you are to help you.
Yes.
Now you are accepting new patients right now, aren't you?
Yes, I am.
Okay, so how can people find you?
They can find me on Orlando Health's website, and I'm part of Physicians Associates.
Wonderful. Thank you so much, Dr. Affont, for
Absolutely.
being with us today and answering all my exciting questions.
Thank you.